Hello, everybody. Thank you for tuning into my podcast today. My name is Shane Gamble, and I'm a dietetic intern currently enrolled in the University of St. Joseph Dietetic Internship Program. Today, I'll be analyzing a research article titled Factors Related to the High Rates of Food Insecurity Among Diverse Urban College Freshmen. Food insecurity is a significant public health issue that affects over 48 million American households. Food insecurity leads to poor nutrition, which can put an individual at higher risk for obesity and chronic diseases. These are some of the reasons why I chose this article in particular to review. So the purpose of this research article was to first look closely at the prevalence or proportion of on-campus college freshmen who were food insecure in the past month or in the past 3 months. Also to examine dissimilarities or differences on health behaviors and outcomes between food secure and food insecure college freshmen. Specifically, health behaviors such as participants' breakfast consumption, fast food consumption, home-cooked meals eaten, fruit and vegetable consumption, healthy eating habits on and off campus, binge drinking, parents purchasing or sending food to students, stress levels, depression levels, and anxiety. Also, the findings will aid in prevention, determining appropriate interventions, and future research for a population that is already vulnerable to this critical issue. So the scientific question that researchers wanted to answer was, what is the prevalence of food insecurity and associations with health outcomes among college freshmen? Now we must decide if the methodology can answer that question. But first, we must examine the methodology. Let's examine the methodology of the study. So let's first talk about recruitment. Well, recruitment was done via floor meetings that were held at 2 college freshman residence halls at the Arizona State University. And approximately 52% of the students who lived in these residence halls attended floor meetings, and those were the people invited to participate in the study. So there's about 79.5% participation rate, 41.5% overall student response rate, and 209 participants were accepted for the study. All participants were compensated up to $50. Inclusion criteria and exclusion criteria. So first, inclusion criteria. Arizona State University college freshmen living in 2 residence halls during the fall and spring academic year 2014-2015. And exclusion criteria. Students who were not freshmen at Arizona State University living on campus during the fall and spring of the 2014-2015 academic year, and also transgender students. Continuing on with the methodology, the study design. The study was a cross-sectional study based on a secondary analysis of data from a NIH pilot study known as SPARK. Now, SPARK stands for Social Impact of Physical Activity and Nutrition in College. And this was aimed at assessing the nutrition and physical activity behaviors of college freshmen. There was a survey that was given, and it was 128 questions with 30 minutes to complete, and the questions that were asked pertained to demographic characteristics, dietary and physical activity behaviors, social environmental factors related to nutrition, physical activity, and weight. And also, there were some other measures. Trained researchers were measuring participants' height and weight. So what were the results of the study? Well, food insecurity was prevalent. 32% of participants reported food insecurity in the previous month, and 37% reported food insecurity in the previous 3 months. Food insecure freshmen had higher odds of depression compared to food secure students. And food insecure freshmen had significantly lower odds of eating breakfast, consuming home cooked meals, perceiving their off campus eating habits to be healthy, and receiving food from parents. Now let's look at the reliability of the answer. This study targeted only college students that were enrolled at Arizona State University. Self-reported data was obtained from the survey, so this puts the survey at risk of bias regarding recall, social desirability, and maybe some college students even misinterpreted some of the questions. The food insecurity items that were used in the study had been validated among adults with children using a different time frame. So it wouldn't be surprising if college students responded a little bit differently to some of these items. How can the article be applied to practice? Well, further research on college freshman food insecurity is definitely necessary, and I think that we should open up the scope to not just public universities, but also include private institutions. And what if we created a shorter survey that was voluntary, open to all students upon admission acceptance? I think that would definitely help. Also, ideas for nutrition-focused prevention of college food insecurity among freshmen could be long-term and short-term solutions. So first, the long-term solutions, which in my opinion are more important. SNAP, which is known as the Supplemental Nutrition Assistance Program, could collaborate with universities to provide more benefits to students during the school year. Also, universities could create a separate meal plan geared toward food insecure students to purchase food at reduced cost with work partnership agreements. Short-term solutions include business relationship between insurer and universities with providing oral supplementation for students as well as coupons, and also college support groups to help students in need by distributing food vouchers from local grocery stores and also food pantry information. Do findings support current dietetic practice? Well, this is a new area of research, and there's limited scientific work on food insecurity among college students. There's only been one peer-reviewed study of food insecurity and health among U.S. college students, believe it or not. And this was also a cross-sectional study that found food insecure students were more likely to report their health as being fair or poor. And there's only been 3 published peer-reviewed studies on food insecurity among U.S. college students, and 2 of those 3 excluded college freshmen. None examined food insecurity among college freshmen living in residence halls. So really, this study is one of the first, and hopefully not the last, in this area of research. What could the authors have done differently to strengthen this article? Well, they could have taken a different approach with recruitment. And by that, I mean they could have made recruitment voluntary, and they could have had their message gotten across through flyers posted in lobbies of the school buildings. They could have reduced the incentive to $10 to save money. Different inclusion criteria also could apply, and that could include all genders of college students who are freshmen at Arizona State University who live on campus, but not just at the 2 residence halls that the study included, but include all residence halls during fall and spring of 2014-2015 academic year. So there'd also be different exclusion criteria, and that would be college students who are not freshmen enrolled at Arizona State University who were living on campus during fall and spring of the 2014-2015 academic year. However, we would not exclude transgender students. Survey format. The survey could have been different. If a survey is quick, concise, and clear, it's more likely to be filled out. So, if you change the format, you get more responses, hopefully. So they could have made a quick 10-question survey that would take maybe 5 to 10 minutes to complete. And also, questions would be only geared toward demographic characteristics, dietary and social environmental factors that are related to nutrition. Conflicts of interest. So it's important when you're reading a research article to look for any potential conflicts of interest that may negatively impact the study. And in this study, there was a conflict of interest because it was supported by the National Institute of Health Common Fund. Was this article worthy of being published? Well, the answer to the question is yes, it was. And that's because this article received a positive quality rating on the Academy of Nutrition and Dietetics Evidence Analysis Worksheet. And this was because all issues were clearly addressed regarding inclusion criteria, exclusion criteria, bias, generalizability, data collection, and data analysis. Here's a list of my references, and this brings us to the conclusion of my podcast. So I just want to say thank you for listening, and I hope that you found this interesting. I think that college food insecurity is a topic that we're going to see a lot more of in the near future. Thank you, and have a great day.